My name is Jamie, and today I'm going to be demonstrating the assessment of a newborn baby using my general principles and safety practices and following 11 medication rights and 3 safety checks as necessary. So I just got the baby from the mom, so I'm going to go ahead and place it into the bin or the bed, and I'm going to turn it on its side to prevent aspiration, and I'm going to suction the mouth and the nose. And I'm going to dry the baby off pretty vigorously, help stimulate it, get it crying. Pick it up a little bit. And then I'm going to change the linens out and put something dry underneath the baby. I'm going to get it put in a warmer. So I've got the baby on some dry, warm linens. And I'm going to do the APGAR score at 1 minute and 5 minutes after birth. So I'm going to go ahead and assess the heart rate for a full minute. Got a heart rate of 110, so that's 2 points. The baby is moving its extremities and retracting them back, so it's got good muscle tone. I'm going to assess the reflexes of the baby by tapping the bottom of their foot or flicking it, and it winced out, so there's good reflex. It's 2 points. I'm also assessing the respiratory effort of the baby. It is crying out a healthy cry, so we're getting good airway. And I'm assessing the skin. There's no cyanosis and it's pink all over. So it's another 2 points. So we have a good APGAR score, and I'm going to go ahead and assess the vital signs. So I would want to listen to that heart rate again for another full minute. Heartbeat still around 110. When I go to get the temperature, I'd want to get an axillary temp. It's good. Then normal limits. And then I'm going to be checking the brachial and femoral pulses and counting the respiration rate. And we will get the blood pressure when the baby is 24 hours old, and we'll use the appropriate blood pressure cuff. And after I do the vitals, I'm going to assess the umbilical cord. It is clamped, and there's no excessive bleeding, and there are 2 arteries and a vein present. So then I'm going to go ahead and set the baby up, and while the baby's sitting up, I'm going to assess their face, their head, their backside, and their skin as well. I'm also going to want to assess the posterior and anterior fontanelles, make sure that they're within normal limits. And I'm also checking for any molding or cephalohematoma. And I'm going to assess 3 different reflexes. So I'm going to hold the baby up so that they could do their stepping motion and do the stepping reflex. And then I'm going to do the plantar reflex, where I touch the palm of the hand and they're going to grip around my finger, and the grip strength should be equal and strong. And then I'm going to do the Moro reflex. I clap, startle the baby, they've reached out and brought their arms back in. And so now I'm going to go ahead and weigh the baby. But before I separate the baby and the mom, I'd want to make sure any appropriate the appropriate identification is added to the baby and the mother, as well as any required printing. So then I would bring the baby over to the scale, and I'm going to lay the baby down, unclothed, and I'm going to keep my hand near it to make sure that it doesn't roll. So we've got the weight. I'm going to go ahead and bring the baby back to the warmer, and I'm going to get measurements. So I'm going to measure from head to toe, and I'm going to make sure that the legs are extended all the way. So get that measurement. And then you're going to want to measure the circumference of the head going around the eyebrow line. And we've got that measurement. And then I'm going to measure again around the chest going along the nipple line. We got that measurement. So once we got all the measurements and the weight in, I'm going to go ahead and put the diaper on the child. And before I swaddle the baby to give them back to their mom, I'm gonna wanna take a cotton ball and I wanna clean their eyelids. And I'm gonna apply medication to the conjunctival sac and bring that eyelid down, apply the medication. And then I'm going to want to give an intramuscular injection of vitamin K into the vastus lateralis. And then the baby's good to be swaddled and taken back to mom. Alrighty. I would put a hat on the baby and we are good to go back to the mom.